Hello. Thank you for allowing us at Atlantic to share our COVID experience at this World Congress of Education and Practice. Let me tell you about Atlantic Health System. We are geographically about 30 miles west of New York City, and we are a 6 acute hospital care sites as well as 1 rehab facility. We have over 550 care sites and service over 7.5 million inhabitants. Our hospitals are either AACN magnet designated or pathways, and we have a rich nursing culture with over 4,200 nurses. Let me introduce the rest of our team. Okay, take it away.
Thank you, Carol. In 2019, the world faced the threat of a novel virus, COVID-19, and it was projected. In fact, in early March of 2020, the Atlantic Health System in the northeast of the United States saw its first patients admitted. There were ongoing surges of COVID-19 that left nurses unsure of how to navigate care and continue to balance their work, their home life, as well as their own well-being. So the nurse researchers from Atlantic Health System wanted to know how to best support our nurses throughout this pandemic. So we began an Atlantic Health System qualitative study, which was designed to investigate nurses' perceptions and care of adult patients at Atlantic Health System. For this study, we used the Roy adaptation model as our theoretical model, and the Roy adaptation system is a holistic system that looks at the individual, family, and community and identifies what the environmental stimuli are and how nurses can best help individuals and communities adapt to the changes that they are facing. So this was a descriptive phenomenology and qualitative study. We recruited a sample from different Atlantic Health System sites throughout the system using snowball methods. We conducted focus groups of between 4 and 5, conducted those focus groups on Teams, which is a virtual platform. The focus groups were recorded and actually transcribed, and then they were coded by the group to make sure that we had cohesiveness. So we had interview engagement with the data, and we coded them as well as analyzed the data and identified some exemplar selections, which you'll see throughout this presentation. We followed up with member checks to make sure that our participants agreed with the codes that we had identified as important to them. And then we compared the findings to the literature to make sure that we were on track. So we had a total of 10 nurses from 4 different hospitals. They were all consented to be interviewed and taped. The focus groups that started in early 2022 and ended in the fall of 2022. Consistent with our population, there were 9 females and 1 male participants. And we identified 2 nurses that were novice nurses, identified as working less than 2 years of experience during the first wave, and 8 had at least 2 or more years of experience. All of them were from different varying workplace settings, and they all felt unprepared for the pandemic, whether they were novice nurses or experienced nurses. The main themes that we identified that you'll hear more about were in terms of stimuli, professional image, and community. In terms of adaptation, communication was key. And in terms of coping, balance became important and memories were also identified as important. For professional stimuli, there were many image sub-themes. The image of the nurses changed. The image changed in terms that they felt pride and their sense of duty continued throughout the pandemic. They held compassion for their patients and often had to play the role as both patient and family in terms of support. They had a desire to see the value in the work that they do, and they were able to sense the nurses' public perception of nurses changing over time, and they felt that COVID actually presented some good as well as some bad experiences. And they did say that this allowed them to look at life differently after the pandemic. Their roles changed as they were asked to work in. There was an increased acuity where they were taking care of patients, and one person would be discharged, and very quickly afterwards they would get another admission. They became step-down wraparound nurses. They became supportive nurses, palliative care. And then some of our OR nurses became med-surg nurses. So that deployment, that floating from one unit to another began. Shifting back to normal nursing care was challenging for some. And the public perception changes. Many nurses would say that they went from being heroes in the public's eyes to being zeros. There was an absolute fear of exposure risk. You can see the quotes here about not knowing in the very beginning if they were going to bring it home to their families, to their children, to their grandparents or parents. And so that was really a huge concern for our nurses working during this time. The novice nurses, as we talked about here, are some quotes that talked about how they were unprepared. What they didn't realize that while they were unprepared, the experienced nurses felt they were unprepared as well because we just didn't know enough about this virus. But it did offer them the opportunity to gain confidence very quickly, and also their skill set really increased dramatically, as you can see by the quotes. We saw a nursing crisis in terms of staffing. Some people retired, some people changed to different jobs, and that was challenging for the nurses that were left behind. Many nurses felt like they just couldn't do this anymore, and so they left just because of the emotional toll. And for those who were left behind, they had a feeling of concern because their colleagues were leaving. And now we'll go on to the community stimuli.
Under community support, we had community support, community opposition, and the internal community of camaraderie. So community support, nurses felt overwhelming support from the community in the donations of food, masks, and equipment. They also saw inspiring lawn signs and messages on the sidewalk. As one nurse said, he was surprised when he told a group of people in the community he was a nurse and they started to clap for him. And he just said, "I'm doing my job." Along with the bitter with the sweet, as the pandemic raged on, nurses were seeing less support from the community and they felt discouraged. Nurses often reflected as what we saw in the literature that supports that nurses in the study were upset with the misinformation and the disbelief that there actually was a COVID crisis. And nurses shared experiences that were emotions that felt like war veterans who returned home, misunderstood, ignored, and underappreciated. But it was their internal community, their coworkers, that really helped pull them through. They felt a strong sense of solidarity with their colleagues, and they had a special sense of through the shared experience where they were only able to talk to the people that work in healthcare. And Janelle will take over.
So our communication sub-themes include communication with patients' families, communication with the team, with the leaders, and with the nurses' families. So first is communication with patients. With not being able to be in patients' rooms all the time, this communication became very innovative and creative. Nurses utilized iPads and calling into the room via the call bell system to be able to communicate with their patients when they were not in the rooms. Whiteboards were utilized for updates as well as for communicating needs, and therapeutic communication became very important. So nurses would often tell them, "We cannot be in here all the time. We cannot, but I'm still here for you. I'm still taking care of you. Here's my phone number. You can call me and I'll look through the window," and having that contact, although it wasn't physical contact with the patients. Next was communication with patients' families. During this time, we did not have visitation. There were no families in the rooms as we had been accustomed to. The floors became very innovative with their communication to families. They came up with a plan to call families upon their shift in the morning to introduce themselves and give an update, and then follow up in the afternoon with an update on the plan of care and what had gone on with their loved one during that time. Perhaps one of the most difficult communications with families is that when they dropped their loved one off at the emergency department door, or when an ambulance came to take their loved one to the hospital. During that time, nurses were instrumental in facilitating those goodbyes, which were not always easy, utilizing Zoom when they were there, utilizing phone calls to keep them updated with the status of their loved one. The nurses at Atlantic Health really made a point of saying how leadership was very transparent and very involved with ensuring that they actively listened to their employees. They were transparent on the floors when they came by and asking, what can we do to help you? Having that opening ear. What is it that we can do that's in our control? The leadership would communicate through huddles, through updates, sometimes updates that went 2-3 times a day with different changes that had occurred. There were text messages, emails, and that constant presence on the unit to support the team. There was also transparency of staff and where they were floated to and the reason why they were floated to different areas. They helped staff understand the rationale for floating, the rationale for pairing up nurses in ICU to be able to care for the most critical of patients. Then there was communication with the team. The team had to get very creative with their communication. Every day they would learn different tips and tricks on different ways to help communicate and overcome the barrier of not being able to have that face-to-face communication or being able to go into the rooms. So the team would utilize the call bells. They utilized those iPads for the electronic type communication, really writing on windows of the doors to be able to communicate different vent settings or vital signs of the patient. They would use the whiteboards in and out of the rooms to communicate and show through windows and really supporting each other with the different methods that they use to be able to communicate with each other. There were a lot of barriers and nurses would adapt and be able to find ways to overcome those barriers. Then there was communication with nurses' families. During this time, the nurses really felt isolated from their families. They were not able to go home and really talk about everything that had happened. They felt that they didn't want to interact with their families for fear that they would bring COVID home to their family members and the feeling that they'd feel terrible if they were the reason that a loved one had gotten sick. They also stated that they felt dirty, that those who were in taking care of those COVID patients did not want to spread it. They felt like they were dirty and they could only hang out with other dirty people. Therefore, there were many phone calls with family members, there were FaceTimes, and there were meetings where people would meet outside 6 feet apart to be able to ensure that they would not transmit the virus to others. The next theme is balance. So the balance sub-themes are searching for balance, finding balance, trauma, and then preparing for the next wave. The first is searching for balance. This was a struggle of both mental and physical fatigue. Many team members during this time utilized our employee assistance program. They utilized their paid time off to be able to take some time away. And really, the team became stronger because they shared their experiences with one another. Emotions were shared and they opened up, they were vulnerable to their different experiences and were able to overcome their stressors, discuss those stressors and overcome the situations. Finding balance, we had some nurses that were always in our COVID units. So to be able to find balance, they would take some time out of those COVID units to allow for taking care of patients in other areas. There was utilizing different ways, conversations about how they were coping. The best people to be able to discuss that with were the team members that were in it together, to be able to discuss their feelings, their emotions, and the different methods they used to overcome that. Many did not go home and tell their spouses or significant others about what had been going on because no one really understood better than those who were going through it at that time. Then there was the trauma. There was a lot of tears that were shed by nurses coming into work and going home. There was a sense of helplessness, of not knowing what was happening, how long it was going to go on, thinking, is this really real life? Is this really happening? And is it ever going to get any better? They were stressed and that they were not able to give the care that they were accustomed to giving, that the care that they wanted to give, which led to a lot of trauma for the nurses. Then there was preparing for the next wave and for the future. Nurses that worked during this time did look at different job roles. They looked at continuing their education and other degrees that were available to them. And some looked at changing their nursing specialty. But what many nurses did talk about is that we have to remain vigilant in the thought of the next wave, the thought of the future and what might happen. Many people thought COVID was over, COVID was done, and it wasn't done. So knowing they had to stay prepared for whatever would come next.
And our last theme is coping, is memories. So nurses talked about their goodbyes, how they facilitated goodbyes for families and staff through mentorship. And there was a lot of uncertainty about patient outcomes because as the nurses floated, they may not have seen that one patient they cared for quite some time. Nurses often talked about COVID being part of history. It was an experience like none other they've seen. And some used military references like deployment, just-in-time training, and really all this work to work as a soldier would in the war against COVID.
So we felt our study was best summed up by "we did it for real." When you really look at the quotes, a lot of this was shock as well as recognition and processing that this did occur and we all did survive. I really like the bottom quote, but I think just really telling the story of what we've been through, not because we want anything really from it, but I think nurses just want to be heard in a way that's just matter of fact. This is what we've done. So when we look at nursing implications, there's several different categories that we can really highlight based on the information we gleaned from our study. And our study team was really dynamic. We have a chief nursing officer, we have a nursing researcher, we have a nurse educator, we have a manager of an emergency department who happened to be an assistant nurse manager during the pandemic, and myself, who's a clinical nurse specialist. So we really did have different perspectives on everything. The first is to really value and respect the history of COVID care. Make sure that you're having open discussions with your team members who've gone through this. Consider doing journal clubs. This allows people time and space to really self-reflect and process what they've been through. And the other is to have memorials for the team members that, people are still grieving that they've lost. Next, really praise that nursing innovation. Nurses are very creative creatures. We can jury rig anything to work. So we have a special department that helps to cultivate nursing innovation. So during the pandemic, we took MRI tubing so that we could put the pumps outside the rooms to try and lessen the exposure from going in and out to deal with, the IVs. We had something called the Pebble Box solution. We also wanted to celebrate people for the things they were doing. So we have a point system and people can take their points and use it on a platform and get gift cards, or maybe they want a new hair straightener, whatever makes their hearts happy. We also did a shout out challenge on Workplace. Now, you may not be familiar with Workplace. It's a social media platform where you're able to engage with all of the different teams from across our system. It was a lot of fun. And then the last is just that authentic recognition. It's nice to get pizza to say thank you and cover dinner, but you really, during that time period, we craved more than just that instant gratification. We really wanted to be recognized for how we helped people. The other thing that it really highlighted was all the different vulnerabilities that were present. So our teams were getting stressed out. So there are different programs you can implement. Our organization went with Stress First Aid, which really focuses on taking a look at yourself as well as your colleagues. Doing unit rounding. You can see a lot when you walk around and you catch people in their element and they don't know anyone's looking. And that might tip you off to say like, hey, Millie, are you doing okay today? The other is absolutely that pause after that stressful event. So remember to do those debriefs. And sometimes people need not only a group debrief, they also need an individual debrief because maybe they really truly didn't process it enough during that first debrief to be able to move forward. And you don't want people to get stuck and keep perseverating and continue to relive that trauma. And then we've already talked about, an employee assistance program, which is a therapist. So there's different resources that we use to try and help our team. There's something called Schwartz rounds where people look at cases and go over their emotions and feelings. Again, I talked about, that employee assistance program or concern. We had focus groups, which people really liked. There are other things like a Zen room, which is a room where you can go into. It's very calming. Everything's, very lovely. You just go in there and you have that sudden sense of, wow, this is going to help me out today. And then we had a rolling resiliency cart, and we learned that our team did not want candy on the cart. So we had to alter the things that we had on the cart. So we added fruit and like Nutri-Grain bars. Personally, I feel the candy more than I do the other stuff, but we were trying to help everybody feel rejuvenated. Again, peer support was huge through everything. And I think I've hit on all of these. The other thing that you really have to think of is, stepping outside the box and learning how to really get to know your patients. I don't think we realize how much people read lips until all of a sudden you're in a mask 24/7 and no one can see your face. So how do we connect with those people? Remembering to use whiteboards, remembering to ask simple questions like, what matters to you? That's so profound when you ask a patient that and they really talk to you, and doing those little personal touches. I know one of our patients wanted some kind of pickle from a farmer's market by our one hospital. And one of our team members actually went to the farmer's market to get them the pickles. Do follow-up phone calls, see how people are doing, get their feedback. And then we also had something where patients or families could nominate nurses for a DAISY award, which is for exceptional compassionate care. Also, remember the positives. We still rang bells when babies were born. We made sure everybody saw those amazing letters about the care that was being delivered. And we have survivor picnics as well. So we will never forget our experiences during this time. So thank all of you, because you're all nurses, for what you do. We appreciate you. And what questions do you have for us?